You know, I have spoken with many seniors over the years, people in their 60s, 70s, even 80s. And the most common question they ask me is, what's the best medicine I can take to stay healthy? And my answer usually surprises them. It is not a drug. It is not a supplement. It is something most of us already know how to do. It is walking. Yes, just walking. Something so simple, yet so powerful. So today, I want to talk to you, just you and me, about why walking after 60 might be the most powerful thing you can do for your body, your mind, and your future. Let me ask you something. Have you ever stood up from a chair and felt a little off balance? Or maybe you notice that your legs feel weaker than they used to, even though you are not doing anything drastically different? That is not just getting old. That is your body quietly telling you, I need to move. As a senior, movement is not just helpful, it is vital. The reality is, once we pass 60, the body starts losing muscle mass at a faster rate. This process is called sarcopenia. And if we do not actively do something about it, it gets worse over time. But here's the good news. Walking can stop that decline in its tracks. You see, your muscles are like your savings account. The more you use them, the more you preserve. And the less you move, the faster they get withdrawn. So walking becomes one of the easiest, most effective ways for seniors to keep their muscles strong and functional. But it is not just about muscles. Our joints, especially the knees, hips, and lower back, can stiffen up. The cartilage between the bones wears down. You may feel creaky, stiff, or like it takes you longer to get going in the morning. That is normal. But it is not something you have to accept without a fight. Walking gently moves the joints without putting too much pressure on them. It keeps the fluid in the joints moving, almost like giving your body a daily tune-up. That is why even just a short daily walk can make a big difference in how you feel throughout the day. And here is something most people do not realize. Walking also helps improve balance and coordination. As a senior, one fall can change everything. It can lead to fractures, hospital visits, and loss of independence. But when you walk regularly, you train your body to stay steady. You strengthen the small stabilizing muscles that keep you upright. You stay more aware of your footing, your posture, and your surroundings. Think of walking as your foundation, the thing that supports everything else in senior health. When you keep walking, you're not just keeping your legs strong. You are preserving your ability to move freely, live independently, and enjoy life on your terms. And you do not need fancy equipment. You do not need a gym. All you need is a pair of comfortable shoes, a safe place to walk, and the willingness to take that first step. Because after 60, that first step matters more than ever. If you're already getting value from this video, then I encourage you to hit that subscribe button to stay updated with our latest content. And also, don't forget to like and share the video. Now, let's talk about something that surprises a lot of people. As a senior, chances are you already have a few prescriptions lined up on the kitchen counter. Maybe one for blood pressure, another for blood sugar, something for cholesterol, and maybe even more on top of that. But here's a question most doctors don't ask enough. What if the most effective treatment is not a pill at all, but a habit? That's exactly what walking is. It is not just physical activity. It is one of the most powerful tools you have for protecting and even restoring your health after 60. Let me break it down for you. First, walking improves circulation. It gets your heart pumping in a steady, healthy rhythm. That increased blood flow helps reduce blood pressure naturally, just like some medications. In fact, studies have shown that regular walking can lower systolic blood pressure by as much as 10 points in seniors. Second, walking helps your body use insulin more efficiently. That is a game changer for anyone managing or trying to avoid type 2 diabetes. After a walk, especially after meals, your muscles pull more sugar out of your bloodstream, lowering your blood glucose levels without medication. That is a massive win for senior health. especially since diabetes rates increase significantly with age. Third, walking helps balance cholesterol. It raises your good cholesterol, the one that protects your heart, and lowers the bad cholesterol that builds up in arteries. So while medications like statins may help, walking tackles the root of the issue through natural regulation. And the best part? No side effects, no warnings, no long list of interactions. You are not trading one problem for another. Now, I'm not saying throw away your pills. That is not what this is about. What I am saying is this: walking gives your body a fighting chance. It helps your medications work better. It can reduce your dependence on them over time. And in some cases, with your doctor's help, it can even eliminate the need for certain prescriptions altogether. That is how powerful walking is, especially for seniors. It is not a chore. It is not just something your doctor suggests to stay active. It is medicine. And unlike most pills, walking does not just target one problem. It helps almost every system in your body. Your lungs work better. Your brain stays sharper. Your mood improves. Your bones stay stronger. All from something as simple, free, and natural as walking. So the next time you think about senior health, do not only think about what you need to take. Think about what you need to do. And walking, my friend, might just be the best prescription you ever filled. Now, let's shift gears for a moment. Because yes, walking is good for your heart and your muscles, but what it does for your mind might be even more powerful. Here's something many people do not talk about enough. As a senior, emotional health becomes just as important as physical health. And for many seniors, life after 60 can feel different. You might be retired now. Maybe the house is quieter. Friends move away. Loved ones pass. And while some days feel peaceful, others feel lonely. And loneliness is more than just a feeling. It's a serious risk to senior health. Studies have shown that chronic loneliness increases the risk of depression, anxiety, cognitive decline, and even heart disease. It can weigh on your mind, your motivation, and your will to stay active. And that's why something as simple as walking can be life-changing. Let me explain. When you walk, your brain releases natural chemicals like endorphins and serotonin. These are your body's feel-good messengers. They help reduce stress, lift your mood, and give you that subtle but powerful sense of, I feel better now. Even a 20-minute walk can clear mental fog, ease tension, and help you sleep better at night. But there's more to it than brain chemistry. Walking gives you a chance to reconnect with nature, with your neighborhood, with your thoughts. You start to notice things again. The smell of trees, the way the light hits the sidewalk, the friendly face of a neighbor waving hello. And in those moments, something shifts. You feel less stuck, less boxed in, more human. And if you choose to walk with someone, a partner, a friend, or even a group, it becomes a social lifeline. Suddenly, walking is not just movement. It's a conversation, a laugh, a memory in the making. For seniors, this kind of regular social connection is vital. It sharpens the mind. It helps prevent cognitive decline. It keeps you engaged in the world. And here's something I tell many of my senior patients. Mental strength is not just about staying sharp. It's about staying hopeful. When you have something to look forward to, something that lifts your spirit each day, your entire health shifts in a better direction. So if you're struggling with low energy, sadness, or even just a sense of boredom, try this. Put on a comfortable pair of shoes and go for a walk. You do not have to go far. You do not have to walk fast. But I promise you, your mind will thank you. Walking is not just physical, it is emotional. It's one of the most powerful tools for mental clarity and emotional healing in senior life. And the best part? You carry this medicine with you everywhere you go. It is called your feet. One of the greatest fears I hear from seniors isn't about illness. It's about losing independence. And honestly, that fear makes sense. No one wants to feel like they have to rely on others to do simple things like getting dressed, climbing stairs, even walking across a room without feeling unsteady. But here's the truth that many people overlook. Mobility is freedom, and walking helps you protect it. Every time you walk, you're doing far more than just stretching your legs. You are strengthening the muscles that support your hips, knees, and spine. You are training your body to stay upright and centered. You are building the kind of strength that helps you get out of a chair without struggling or catch yourself if you trip on the edge of a rug. Falls are one of the leading causes of injury among seniors, but most falls are preventable. Walking improves your posture, your core strength, and your reaction time. It teaches your body how to move with control again, not with hesitation. That is the power of consistent walking. It gives you confidence in your own body again. It tells your brain, I've got this. And when you feel strong, steady, and secure, you do not just move better, you live better. You feel more in charge of your day, more comfortable doing the things you love, and most importantly, more independent. Because at the heart of senior health is not just survival, it is dignity, freedom, and the ability to live life on your own terms. For seniors, building a daily walking routine does more than just help the body. It gives structure to your day. It gives you something to look forward to. And whether you walk alone with a friend or even with a dog, that simple habit can add meaning and rhythm to your life. It is not just a walk. It is a small promise to yourself every day that you are choosing to take care of your future. If you are over 60, I want you to know this. Your body still responds. Your health can still improve. It is never too late. And sometimes the most powerful change does not come from a bottle. It comes from your feet hitting the ground, one step at a time. Start small, just 10 minutes today, then 15 tomorrow. Before you know it, you will feel stronger, sharper, and more confident in your own body. If this video helped you, please hit that like button and share it with someone who could use it too. And of course, subscribe for more tips on living stronger, longer, and better. Thank you for watching and see you in the next video.